Okay, I'm ready. I just
I'm
started.
staring at my camera, not my web camera.
Correct, correct. And
All
we
right.
have just started the recording, so let's go ahead and begin.
All right.
Okay, hold on.
You can stick mine. Go ahead.
Welcome to Cosmetic Networks Live, where we explore the aesthetic and the cosmetic industry from the inside out. Hi, I'm Sheila, and this is episode 16 for Friday, July 19th, 2013. We have a really special guest today, Dr. Joseph Berenholz from Detroit, Michigan. Dr. Berenholz is a certified obstetrician gynecologist for the last 25 years. He also is the first gynecologist to introduce laser cosmetic gynecology to the Midwest. Welcome, Dr. Berenholz.
Hi, Sheila. How are you?
I'm doing great. How's your day?
It's great. A little warm here in Michigan.
Warm in Michigan, amazingly probably a little humid.
Very humid, but we love it. We only get 3 months of summer a year.
Right, so absorb every minute of it, right?
We are. We're enjoying it.
Well, a couple of things that I want to share with our audience about you is that I know you have 3 amazing grandchildren, and you're an avid golfer, and you love fitness, and you're into martial arts. But one thing I really want to focus on and have you talk a little bit about is your passion about helping children with autism. Can you share a little bit about that?
Sure. I don't know who you were talking to, but you found out a lot about me that I don't remember telling you. My daughter, Lisa, works with autistic children, and she's been working with them for years. And I've started a project with people here in Michigan to help children who have been diagnosed as severely autistic through a use of holistic approaches, diet, essentially cleaning the gut of these children, detoxing them, and chelating them of their heavy metals. It's a multifaceted approach, but I've seen evidence where kids that were diagnosed severely autistic suddenly are mainstreamed and are doing very well. So my goal is to make sure autistic children never become autistic adults.
Wow, that is a really great thing. I know that there's a lot of passion behind that whole movement, and I'm really excited to hear you be so involved with that.
Right.
You know, as I was looking at your website, you have so many amazing things that we can talk about and so many things that women need to know about. And, you know, we have a limited time today, so we're going to start with laser vaginal rejuvenation and hope to hit every one of those points throughout the entire year. But let's start with, share with us, what is laser vaginal rejuvenation?
Okay, well, laser vaginal rejuvenation came into my world about 9 years ago. I was sitting at home late at night on the computer, and it just occurred to me that I had so many complaints from my patients about their dissatisfaction with sexual relationships with their spouse or with their partner. So I began to look into the possibilities of doing elective surgery to help tighten the vagina, increase sensitivity, and therefore increase the enjoyment of sexual relationship. And I came across Dr. David Matlock in Beverly Hills, and we befriended each other, and I actually flew out and trained with him. And we use a diode laser, which is a fiber that's as fine as your hair. And we use it as a cutting instrument to excise the excess tissue. We bring the muscles back together to the way they were, and women are extremely happy. The interesting phenomenon is no one was willing to talk about this in public, and it's taken all of the 9 years that I've brought it to the Midwest to finally be accepted. And now, of course, people interview me, people want me to advertise in their magazines, but it wasn't received that way. And the other thing we do is we sculpt labia that are too long.
Wow, that's really awesome. It's great that women can have hope, you know, through something they didn't even realize was a possibility for them. So, you know, in regards to a patient that would be a good candidate for this, might they experience pain, and that might make them think that they're a candidate, or are there other reasons and signs for them to be a candidate for this type of procedure?
No, it's never really pain. It's always the opposite. As one woman once said to me, the only way I know my husband's making love to me is I see him on top of me.
Mm,
So that was sort of a sad statement.
very.
Women have children, some women do, and children, if they're delivered through the birth canal, cause a lot of trauma. That trauma translates into vaginal looseness. And what's made us so successful is that women have gone to their obstetrician gynecologist and complained, and they've been told, Kegel, do your Kegel exercises.
Right.
And this is all part of the natural process. Well, they all Kegeled for 2 years, nothing changed, and then they come to us.
Wow, that's really good to know. You know, I think if more women out there were aware of that, they would come to you a lot sooner, knowing they could get better results and quicker.
It's not an easy subject to talk about with a girlfriend or a husband.
Right. Now, is the procedure painful with the laser?
Well, you are under anesthesia when we do the procedure, and we do what's called a local block, where we block the nerve endings to that area. And that keeps you pretty much free of pain for the first 7 hours. But what I tell women who need extensive tightening, you're going to feel as though you had a child and had an episiotomy, but there's no child when you wake up. It's just the pain of rebuilding those structures. And by the 3rd day, that's pretty much under control.
Well, that's a good explanation and a good comparison, because once a woman has a child, they do know some very serious pain, and so that probably is minuscule compared to that, right?
Right, right.
Now, you know, some women might ask or be afraid to ask, can a woman with an STD have a procedure like that?
Well, it's an interesting question. I've never been asked that, but the answer, of course, is we'll treat you and then we'll operate you.
Okay.
STDs should not be an impediment, but they should definitely be treated right away.
And how long after a vaginal rejuvenation procedure can a woman have intercourse?
That's difficult, too, because we make our patients wait about 6 to 8 weeks. And if it's not the husband, it's the patient who constantly calls and says, now can we do it? And so it's very tough. And every once in a while, people cheat, but no harm has ever been caused by going a week early. But generally, the waiting period is anywhere from 6 to 8 weeks.
So if a woman happened to jump the gun on that and maybe go a little earlier, is it something that would need to be repaired later, or just takes longer healing process?
I've never had that happen. The only thing that has happened in our practice, and don't ask me why, but we've had 3 patients over the years who, for whatever reason, felt it was all right to go horseback riding.
Oh,
and even
my.
in those patients who broke down their skin repair, they never broke down the actual repair that kept them tight. But from now on, in all of our consents, we mention horseback riding.
Yeah, that's true. That's a great example. Let's talk a little bit about robotic surgery. You know, how is this actual procedure performed? Because I know you use this in some things that you do.
Well, robotic surgery is really amazing, only because it allows the surgeon to place his vision inside the human anatomy. And we're literally right next to the areas that we want to repair or dissect. So prior to that, we would do laparoscopic surgery, and we would be staring at a television screen. And that was fine, but you were still at a distance. With robotic surgery and our robotic team over at Providence Hospital, we're able to see inside the human anatomy. We're able to place our eyes next to the very tissue that we want to take care of. It's far more precise, but it requires lots of training. And one of the problems today in the United States is there are a lot of surgeons attempting robotic surgery, but are lacking experience.
Wow. So how would you be able to let the public know what type of experience you have and that you are totally ready to perform that type of procedure with confidence with the robotic surgery?
Well, first of all, using your network is a great start. But after 25 years, believe it or not, the word has filtered out, and people come to me through various physician references, or I've operated on family members or friends. So we don't market as heavily in the area of robotic surgery, only because in the world of general gynecology, we're very well known in the metropolitan area. But the cosmetic surgery that I do brings people virtually from everywhere in the United States, and we've had people from as far away as Asia fly here for the surgery.
Oh, wow, that's really awesome. That says a lot for your skills and who you are. That's pretty impressive.
I hope that's what it means.
Yes, absolutely. Share with me, first of all, what are the most common procedures, though, that you would perform with a robotic type surgery?
Well, we do everything from hysterectomies, where patients go home the same day, to myomectomies. Those are patients who have fibroid tumors that they want removed but don't want to lose their uterus. And then there are some patients who've had previous surgeries and now they have scar tissue that's causing all types of discomfort for them. And the nice thing about robotic surgery is you can meticulously take down these adhesions, which is what they're called, and it helps relieve pelvic pain. So it's turned out to be quite an advancement in the area of gynecology, and as you know, the urologists are using it for prostatectomies where they're sparing the nerve endings so men are no longer impotent after a prostatectomy or the removal of their prostate.
Wow, that is great to know. Now, is there less pain with this type of procedure because it's less invasive? I'm assuming less invasive because it probably goes in smaller incisions. Is that correct?
Okay, so you're right. There's no incision. There is a series of small incisions or stab incisions, but you don't have that long incision we make with a laparotomy. And so the morbidity, or you call it the pain afterwards, is far less.
And so did you say this is done under a general or a local anesthesia?
Always under general anesthesia.
Okay.
Right.
I want to touch really quick on something that I know has been just something you've been dealing with for quite some time, and that is public acceptance. So tell me about some hurdles that you've had to jump through when just sharing the fact that vaginal rejuvenation from the cosmetic spectrum and visual and the media, and how those two have related or collided.
It's kind of humorous. When I came here 9 years ago and introduced cosmetic gynecology, I placed an ad in the upscale magazine that we have here in the metropolitan Detroit area called Our Magazine. And they were inundated by irate callers who said, "How dare you use the word vaginal in your advertisement, and you have to take the ad down." In fact, Our Magazine offered to return my money if I would stop advertising.
Oh, my.
But now, of course, they beg me to advertise every month in their magazine. But it was difficult. We do live in the Midwest here, and we're a little more conservative.
Right.
Even the television interviews I've had on the local ABC, NBC, or CBS networks reminded me each time I'm never to use words like vaginal or anything close to that. So it made talking about it difficult, almost humorous during the radio interviews that I had, because I couldn't mention the anatomy that I worked on. So we had to be pretty innovative and imaginative.
So then how is that accepted today? Because I'm sure that was quite some hoops.
Well, today it's much easier because of organizations like yours, as well as Dr. Oz doing a program on it, Beverly Hills 90210, and the doctors and all the other medical information shows that now are on television have all at least devoted one episode to vaginal rejuvenation and to labiaplasty. So it's helped public awareness. But even today, we have patients who come to us and say, I had no idea this was available.
Oh, I agree. I agree. I think this is still so very underexposed. And yes, this platform is a great opportunity to help women across the world to, be able to get something that maybe is so subconsciously and quietly and personally important to them, have it addressed.
Right, right.
And I'm also thinking about the woman that might be coming in for a consultation into your practice, and she may be very apprehensive, and especially about the stigma behind the political acceptance behind this. What could she do to help her feel a little bit more confident when coming into a consultation like this?
Well, we reassure the patient when they arrive that they're not the only ones. You have to remember, I've operated on well over 1,000 women for this very problem. So when they go through our albums of letters, albums of photographs, albums of endorsements, thank you letters, they realize that this is something that they shouldn't be embarrassed by, but instead should utilize our services so they can improve the quality of their life. So it's no longer, I believe, the pariah of people who think that this is politically not acceptable.
That's great. That's great. And, the friendliness of the staff also, I think, helps the women feel so much more welcomed and that they can share, and knowing that this is something that your practice talks about every day, so it's okay for them to talk about it in the practice.
Right. It helps to have a great staff, and I can't say enough about ours. We've educated our staff, and in fact, our staff even refers people to us. So we're appreciative of the environment we've created here at Laser Vaginal Rejuvenation Institute of Michigan, which is the cosmetic portion of our practice. And then, of course, we do general OBGYN, which is the Michigan Institute of Obstetrics and Gynecology.
On that lines, in regard to some other procedures, can and is very often a vaginal rejuvenation procedure included, like in a mommy makeover?
We've had lots of patients come in and they've wanted a breast lift or augmentation, a tummy tuck, and a vaginal rejuvenation. And we've done that for them. Of course, it takes a lot of coordination with the plastic surgery. Right. But they've come here, but when they wake up, they're brand new from top to bottom.
So with that said, let's say a woman has had a vaginal rejuvenation or maybe even a mommy makeover, and she finds out that she's pregnant with another child. How does that affect the vaginal rejuvenation procedure that she had just had done?
Right. Well, we make sure that they sign a consent that states that they're not to have vaginal birth afterwards because they could tear down the repair, and that would be sort of senseless. So we ask them to agree to have a cesarean section if they plan on getting pregnant again. Most of our patients don't plan on getting pregnant again.
Right.
So that hasn't been a great issue, but they understand the only way to avoid any more damage is to have a C-section.
Right. Okay, that's good to know. We're getting to the segment now that is our Q&A segment, and I'm going to ask you 5 questions that I'd like for you to give me an answer for about a minute to a minute and a half max.
Sure.
And the first one is, what is the recovery time for a vaginal rejuvenation procedure?
Well, as we mentioned before, it's 6 to 8 weeks, and it's 6 to 8 weeks for a labiaplasty or laser reduction of the labia minora that are too large.
And what are some of the signs that a patient is a candidate for a vaginal rejuvenation procedure?
Well, this we leave up to the patient. It's their dissatisfaction that drives whether or not we will do a procedure. We try not to make decisions for women. However, we have had patients who we feel have had nothing wrong, and we've unfortunately had to say no because we felt it wasn't ethically correct, and we asked them to reevaluate the way they feel about their body image.
That's great. What are some of the risks with a vaginal rejuvenation procedure?
Well, the risks are like any gynecologic surgery. Bleeding and infection are the top two, but we so rarely have that happen that fortunately our risk of the incidence of complications has been extremely low.
How common is loss of sensation?
We've never had a case.
That is awesome.
It's on the consent, on everybody's consent, but we've never had a case that was like that.
Okay, and how long after a vaginal rejuvenation procedure can a woman use a type of birth control like an IUD?
Easily within 5 to 6 weeks.
Great. Well, thank you, Dr. Berenholz, for your time. You just are a world of knowledge, and it has been so fun having you on the show. We hope to have you back again soon. Can you please let our viewers know how they can contact you?
The website is www.dr for Dr. Berenholz, BERENHOLZ.com. Or you can simply call us at 248-855-2229 or email us at jberenholz, BERENHOLZ @jberenholz.com.
Thank you, viewers, for watching us today. I'm Sheila with Cosmetic Networks Live, and until next time, have a beautiful week.
Have a